Welcome, good evening to another live stream here on the Ultimate Fertility Guide. I'm Natalie from the Fertility Podcast, and I'm delighted to welcome Dimitris Kavakas, who is the Managing Director of IVF Travel. We tried to speak before, and the technical gremlins got the better of me. And what happened was we started talking and then we disappeared. So apologies. And Dimitris, welcome to the live stream. How are you?
Thank you, Natalie. I'm doing fine.
And I'm so glad that I've got you a second time around because, like I say, it didn't seem to work the first time. But that's the beauty. Apparently, that's the beauty of live streaming. So,
Yeah, technology.
yeah, exactly. When it works, it's wonderful. And when it doesn't, it's just a real pain. So, if this is the first time you've joined us here on the Ultimate Fertility Guide live stream, the whole point of what I've been doing with the Fertility Podcast is to talk to experts working in the fertility industry to give you an insight into the different services that are available for you. And I've launched the Ultimate Fertility Guide to try and make it really straightforward. So everybody that you're here talking on this stream with me has joined the guide, and it's a really straightforward listings directory. And the point is with these live streams is you get to ask them questions and I get to interview them, because what happens with my podcast is often people come and ask me questions once I've done the podcast and I can't answer them, whereas when I've got the expert right here like Dimitris, you can ask questions. So feel free to get in touch. A number of you have already posed your questions. So I'm going to be checking your comments and questions, which is why I'm looking over to one side. And as always, it always takes a little bit slow, Facebook, when you're kind of looking over at the screen. But Dimitris, let's start by talking a bit about IVF Travel and what it is that you've created. So tell me a bit about the company.
Yeah, the company Radio Limited, which is the company that owns IVF and runs IVF Travel, is a consulting company in the fertility industry. So we have been there. I've been working in the fertility sector for more than 6 years. But last year we introduced the IVF Travel Portal, which is basically a portal to offer patients the possibility of getting fertility treatment, particularly multi-cycle refund guarantee program. So, and to include the travel component to that, meaning that, for example, UK patients who cannot afford the high cost in the UK, particularly private clinics, if they don't have the NHS funding, they can go abroad in other European countries mainly and have affordable treatment. However, in addition to that, they can get a multi-cycle package of IVF treatment or egg donation with a refund guarantee that reaches 100%. Yeah.
Okay, the sound just cut out then. The gremlins are back. So the multi-cycle refund packages, if people are thinking about traveling abroad, because it can be quite overwhelming, you guide them through and advise them how best to, I suppose, plan their treatment, because the whole idea of multi-cycle is daunting in itself, because you're thinking ideally you just want to have one cycle. So people can come to you and go abroad just for the one, can they?
Yes, of course, this is an option. However, what we actually created is a peace of mind for patients. So a patient will come and they will need an IVF treatment. For example, in the UK, if they don't have the NHS funding, they have to go to the private clinics and they'll have to pay something like eight to £9,000. Including medications and everything, ICSI and all the lab methods. So this is the approximate amount that an average UK private clinic will cost. So for a little bit more than that, the prices depend on the clinic they go and also on the risk. So obviously younger women have a lower cost because the risk is lower for a refund. As the growing age, the prices go up. So we divide it into 8 categories. So depending on where they are, they can get a full 3-cycle refund guarantee program that includes all transfers, all fresh and frozen, all medication, all lab methods, ICSI, blastocysts, embryoscope, and whatever is necessary for the same price as 1 or 1.5 cycle in the UK, which is really affordable, and they have the peace of mind that if they don't succeed at the end of the day, they will get the money back.
Now, just talk to me about some of the areas country-wise that you work with, because again, it does seem daunting to think that you might go to a country that isn't English speaking to have something like this kind of treatment, when it's hard enough to get your head around all the processes anyway. So what countries do you work with clinics in, or how does it work?
First of all, let me tell you that all the clinics we work, before I tell you about the countries, all the clinics we work are screened by us, because obviously we have put ourselves in a risk. We are the ones that guarantee the refund. So if it fails, we have to bear the cost and the losses. So it's in our vested interest to make sure that our partner clinics are the best. They offer the best service and the best result. So all of them have medical expertise and doctors that are trained either in the UK or in the US. They are fluent in English, obviously, and they have a whole international department of coordinator and support staff that speak fluent English. So there's English language availability in all clinics that I work. This is a requirement from my partner clinics. We work with clinics in Europe. That includes countries in Spain, like Spain, for example, Greece, Cyprus, Turkey, and Czech Republic. And we also work with other locations internationally. We work with Malaysia, we work with India, we work with Mexico and Nicaragua in Central America. We do not work only with UK patients, although we are a UK company. That is why we work with global clinics. Malaysia, for example, may be too far for a UK patient, but it's very close and popular to our Australian patients. And Mexico is popular to our US patients. So we cater for every patient, whatever they are, and we try to offer the appropriate package for them. Now, traveling abroad is not that difficult. Everybody travels for holidays. I mean, if you ask the majority of UK people, they almost every year, if not every year, every other year, they go to Spain or they go to Greece for holidays in the summer. I mean, it's the same thing. It's like going for a holiday for 10 days to have a treatment that will cost you a fraction of the cost that you will pay in the UK.
Can you just repeat? I know costs are going to be different depending on your treatment, but Stephanie's asked, what are the costs? Can you give a kind of ballpark figure? Because just before you mentioned about the cost being much cheaper than having treatment in the UK. Is there an average cost that you can give?
For the packet, for the 3-cycle full money back guarantee, you mean?
Well, why don't you tell that? Because I think that's an interesting way to start, and I know that all the information is on the website.
All the information are on IVFTravel.com. So obviously I cannot talk about average prices, but I can talk about the lowest prices. So that the starting point. For example, at this moment, if we talk about women or an IVF with own egg, younger than 35 years of age, so up to 34, we have a price that is less than around £9,000, which is the cost of a single cycle in the UK. For the same money, they get a 3-cycle full money, 100% refund guarantee with everything included. So you see what I'm talking about.
Yeah, it's quite remarkable and breathtakingly, staggeringly different, I should say, rather than breathtaking. It is insane, the difference in cost. Now, you mentioned before about 10 days, the idea of getting your head around it being like the period of time you'd spend on a holiday. And I have had Carrie ask, how long do you need to be away for the whole process? Would you say 10 days or a bit longer?
Let me explain, because it differs according to the treatment. If we're talking about the stimulation IVF, that's the own egg IVF, they have the options of doing one trip or two trips. If they do one trip, they do all the tests in the UK, but screening tests are more expensive in the UK, because screening tests, pre-treatment tests, are not included in the cost of the program, obviously, because it's before the IVF. But they have the choice, the option of doing them in the clinic they want to go for a much lower cost. So they go there for 2 days to do the tests. They get the protocol. They are getting the medication, and then when they start the stimulation and the monitoring in the UK, and they travel for a week. They travel to the clinic for 1 week. If they go just once, if they do all the preparation and all the screening tests in the UK, they need to go there for 10 days. So that's the maximum they need to be there. If we're talking about egg donation, though, in the 2-trip option, the 2 trips will be 2 to 3 days each, not more than that. If they go for the 1 trip, they have to be there for a week, because they have to be in the country, in the clinic, before the egg collection of the donor, for the husband to provide, unless the husband does a trip on his own for a day to provide the sperm sample, and then they can just travel for 2-3 days. So in egg donation is less, but being there for, even if it is for 10 days, which is the maximum, it's like an average holiday period for most of the people who go for holidays.
Now let's just talk about egg donation, because you've just mentioned it, and you and I were talking before, and you were saying how there is a significant increase in people from the UK travelling abroad for egg donation because of the changes in the anonymity laws in the UK. You've seen an increase in that. Are there specific countries that people are favouring?
Egg donation is in the increase generally throughout the world because of the modern lifestyle. As you know, women getting married late and avoid trying to get pregnant until the late 30s, and their fertility dropping. So the egg donation, the necessity for egg donation increases rapidly throughout the world. But there are 3 different reasons for people to travel abroad. One is cost. So people travel for something that is cheaper, more affordable, because they cannot afford a high cost in their own country. A second reason for people to travel abroad would be legislation. So there is something that is hindering them to have the treatment they need in their own country. And in this case, the legislation in the UK that gives the right to children to find out about who is the donor when there is the age of 18, deter donors from donating, because young women, when they want to be egg donors, they don't want to have a queue of teenagers knocking on the doors 18 years afterwards. So there's limited availability of donors in the UK. So because of the increased demand, this demand cannot be met, and people decide to travel abroad. The third reason is quality of service. And we have a bit of that in the UK. IVF has become a little bit of an industry, like come and go. Protocols are not tailor-made. There's a lack of, I get it from more and more people that in the UK, they get the feeling, particularly NHS, that they're treated like a number. They don't approach the case individually to focus on what is the specific problem, to offer them the protocol they really need, and to monitor, to bring results. This is something that clinics in other places in Europe, such as Spain, Greece, and Czech Republic have really mastered and offered this service. So these are mainly the reasons why people would choose to travel abroad for such a treatment.
It's sad but true what you've said about patient feedback. I speak to people all the time who reiterate what you've just said about feeling like a number. And considering the UK, is the origin of IVF, it is kind of hard and sad to hear. But at the same time, good to know that there are options available for us now. Rebecca asks, is it cheaper to go abroad? We've kind of covered that already, Rebecca. So I will be sharing the details of IVF Travel's website in a minute. So you can check out all the costs because I want to just move on to some of the other questions. And do keep asking. You can either post them on the live feed or direct message me. I'm trying to keep tabs on your questions. So thank you for them. Dimitris Kavakas has said, do you have shared care with any UK clinics? And I think what she means by that is there a kind of association if you've started having some investigation at a clinic in the UK, or you've got a relationship with a consultant and then you're choosing to travel abroad? Is there any link?
Yeah, first of all, we have medical advisors, and we have medical advisors, doctors who are associated with us in the UK, but also in the US and in Australia. You can see our team on our website. Apart from those consultants that they work with us, we have a network of supporting labs. For example, we guide people where to go to have the blood test, the scans, everything they need in the monitoring stage of the treatment, because they spend the first almost 10 days of their stimulation if they're for non-egg IVF, or the intermittent preparation if they are for egg donation in the UK before they travel abroad. So we cover the whole. We care for them and we guide them through, depending on where they live, of course. It's easier if they live in the south, around London. We have available. It's easier in Manchester. We have support in Manchester. It may not be that easy in rural areas in the UK, but we try to find solutions for everybody to guide them through the labs that are reliable, because this is, as you said, UK is the first country to invent IVF, and it's so difficult to find good and reliable labs to offer same-day results. It's amazing. You can find them in London, of course. Everything is there in London, and you can find them in Manchester. But if you want to go to small cities, they don't. And so we have really difficulty to find such labs because, as you know, in IVF it's essential that a blood test, we have results for blood tests, hormonal blood tests on the same day, so we can guide them and give them the dosage of stimulation they need to take.
So if somebody listening or a couple listening have started investigations, maybe with their GP, and they have been told that they do need to have fertility treatment, and they are having to self-fund, would the next step be to then go and see your consultants to then get all their notes together to then go abroad? Because, for example, Jules has said, how do my records get shared? So can you just explain a bit about how that happens? Because obviously you want to make sure that, you know, all your notes are where they need to be as you make the journey abroad.
Yeah, the notes and all the results of the patients are safely kept and are not shared without the consent of the patient. We comply with the GDPR rules, obviously, and what we ask is for specific test results, the screening test, to be able to see whether the patient, the candidate, is eligible for a refund guarantee program. So ovarian reserve, for example, tests, scans, semen analysis. These are things we ask, and this they provide this test, which our consultant makes the decisions on them.
Yeah.
And depending on the choice of clinic, following their consents, they are forwarded to the clinic of the choice, so they can have they have direct contact with the clinic and they prepare for the treatment.
Is there any age restriction for the multi-cycle?
For the multi-cycle, yes. If we're talking about on-egg IVF, the refund guarantee is up to 39. It's 100% up to 37. It's 50% refund between 38 and 39. There's no refund after that. However, in egg donation does not have an age restriction, and we have 100% refund guarantee in egg and embryo donation of any age.
Okay. We're almost heading towards running out of time, so I just want to move through. I've got an interesting question from Danielle, who says, how different is IVF treatment abroad compared to the UK? Now, obviously, we've talked about cost being a factor, and you've talked about the importance you put on, the English-speaking nature, so people don't have to worry about there being that language barrier. Are there significant differences? I mean, or is it pretty standard treatment? Is it all down to customer care ultimately?
You see, it thinks that in order to get a quality lab and clinic in the UK, you have to really go to the center. You have to go to London to the expensive clinics, private clinics. The average clinic do not have all the facilities that most of the European clinics have, because they have invested. For example, Spanish clinics have invested on the infrastructure. I go everywhere and visit every clinic we work with and visit the labs, and I see clinics that are really exceptional in high standards of the latest quality of infrastructure. You see, the 70% of IVF success is not in the doctor, is in the lab. So the more latest quality lab they have, and the more experienced embryologists they have, the more the success rate goes up. So people tend to see on the doctor and focus on the doctor too much, but this is just the 30% of the success. The majority, as I said, is a sound lab, and this is where most of the times UK clinics, average UK clinics needs. And if they do have the infrastructure like some of the London ones, they are very expensive.
Interesting. I've got another question here from Louisa Hatcher. She says, will the multi-cycle program cover those with multiple IVF failures?
If they meet, depending on the case. I mean, until we see a medical history, we cannot really talk about. We don't have a criteria for multiple miscarriages. A multiple miscarriage may be chromosomal anomaly. For example, we may offer them the guarantee if they do NGS. NGS is the newest form of PGD, of PGS. It screens, it's a biopsy on the embryo with the latest technology, and find out all the mutations and all the abnormalities that an embryo can have. So to make sure that the embryos that are transferred are healthy ones. The vast majority of multiple miscarriage cases are due to abnormal chromosomes on the embryos. So if we have a case as such, we will still offer the guarantee program, but we will ask for specific extras to make sure that we won't be at high risk, such as the NGS, for example, that is charged extra. Okay.
Louisa also asks, is there a directory of which clinics, which is on your website, isn't it? And I'm just going to share now.
We don't have clinic names on our website. We have locations.
Okay.
We don't want to advertise clinics. When patients ask us and we advise them personally, we do tell them the names of the clinics, and we eventually bring them in touch with them, but we don't advertise clinics on a website.
Okay. We're just sharing your website details so people can go and get all your details, as well as your social media handles, and people can come and ask you more questions, because of course every case is bespoke, and what we've just been talking about is that emphasis you put on bespoke care. So do get in touch with Dimitris if you want to know more, and of course there is a lot more information on the website.
Me and my team will be happy to speak to you. We are available online. Most of the times we have live chat. We're not always there, but if we're not there, you can just leave us a message and your email will come back to you. And we have a Facebook inbox, so you can send us messages. So we are available. So we are
Great.
open to answer any question and give any information that you need.
Great. Great. All right. Well, it's been great to talk to you. And I'm just going to share your information one more time. So if you want to make a note of how you can get in touch with Dimitris, that is the website for IVF Travel, and also the social media. And of course, all of the people that you're hearing speak to on the Ultimate Fertility Guide live stream are a part of our guide. So we're going to say farewell, Dimitris. It's been good talking to you. Thank you. Thank you for your time.
Talking to you. Thank you.
And make sure you've made another note of our next live stream that's happening tomorrow night at 7:30 again. We are going to be speaking with BabyQuest Foundation founder Pamela Hirsch, who again was due to speak to me previously, and the gremlins of Facebook had the better of us. So Pamela will be answering your questions about the BabyQuest Foundation grants that they have programs available for you to apply to get assistance with your funding if you are in America. So obviously I'm broadcasting to you from the UK, but this is only available for you if you are in the US. Thank you again for your time.